Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Hip fractures are dangerous, they're painful, they're expensive to treat, they require many months of physical therapy to help rebuild tissues, and they're pretty common. So how do you reduce your risk of a hip fracture? Well, you have to help solidify your bones. And that's what we're going to be discussing on today's episode. Nutrition for hip health, especially your bones. Hi, my name is Jerry Hickey. I'm a nutritional pharmacist. I'm also the Senior Scientific Officer, the SSO, over here at Invite Health. And on today's episode, we're going to be discussing nutrients that help rebuild your bones. So we're looking at it from my perspective, nutrition. Now, please subscribe to our podcast episodes, and if you could leave us a review, I'd appreciate that. You can also follow us if you want on Facebook, Twitter, and Instagram at Invite Health. Any information on today's episode is linked in the episode description, so let's get going. There's a number of nutrients needed to maintain and build bone. A lot of things are needed for bone. By the way, bone building takes place at night. So if you're not sleeping at night, you really should look at melatonin. Research shows that melatonin is core to building and maintaining bone. This becomes incredibly important as people age, where there's a risk of a decline in melatonin release. There's a gland sort of on the bottom middle of the brain called the pineal gland, and when it starts to get dark, it starts to release some melatonin that sets you up for sleep. But melatonin is involved with many important health functions, including immune system function, controlling blood pressure, and also building bone. So it's not just sleep. So let's just review very quickly nutrients intimately involved with bone building. I mean, there are some on the periphery like zinc and vitamin A, beta carotene, but there are some that are core. So we start with vitamin D. Well, actually, we start with collagen. Collagen is a protein that the body makes, and it's the framework of your bone. We call it the organic matrix. And 90% of this organic matrix, which accounts for about 35 to 40% of your bone, is made out of collagen. The problem is we make less collagen with age. So older people might want to take some collagen, type 1 collagen, to help maintain their bone health. That's exactly what calcium attaches to. Then you need vitamin D. What does vitamin D do for bone? Well, it does several things. First of all, it allows you to absorb calcium from your digestive tract. Calcium is pretty much absorbed from the upper digestive tract, although some is absorbed from the colon. Vitamin D is required to absorb calcium from food and from supplements and to keep it available. And then you need vitamin K to shove calcium into the bone. And then you need magnesium, a mineral, to solidify the connection between the calcium and the collagen to keep the calcium in your bone. So it's not just as simple as vitamin D and calcium or a drug. You also need collagen. Now, how does calcium attach to collagen? Well, it's an interaction between hormones, the mineral silica, vitamin K and vitamin D. They kind of do a dance in and out of the collagen, and they create receptor sites that calcium can attach to. So about 36% of your bone is collagen. Some of the estimates for calcium is between 15 to 35% of your bone is calcium, depending on how you look at it. So you need vitamin D to absorb the calcium. You need vitamin D with vitamin K and silica to interact with the collagen to create receptor sites for the calcium. You need vitamin K to shove the calcium into the bone, and you need magnesium to solidify the bond between the calcium and the collagen so that you maintain your bone. So all of those nutrients are important. And you also need potassium from fruits and vegetables to keep your blood a little bit alkaline, because if the blood gets acidic, the blood has to borrow minerals from the bone and just to realkalinize the blood, and just having an acidic type of diet lacking fresh fruits and fresh vegetables can lead to bone loss. So indirectly, potassium is very important for bone. So let's look at some of the evidence on hip fractures. Here's a report. This is a very important report. It's from the Fred Hutchinson Cancer Research Center, which is in Seattle, Washington. Now, it's a study of over 36,000 older women. It's part of the Women's Health Initiative. And if they took their calcium and vitamin D, because some of them were just not taking their calcium and vitamin D sufficiently, they had to take 80% of the calcium and vitamin D supplement to really affect bone. But it powerfully protected them from a hip fracture. It's published in the journal Osteoporosis International. It reduced the risk of a hip fracture by approximately 38%. This is very important, and that's only part of maintaining hip health. Just to go to some of the statistics, the most recent I saw, worldwide, 22% of women who have a hip fracture die from complications of the hip fracture directly resulting from the hip fracture over the following year. They still have an increased risk of mortality in the second and third year after a hip fracture, but the risk drops significantly. And why is there a mortality from a hip fracture? Well, mostly from infections like bone infections and blood clots. And for men, it's even worse. Worldwide, 36% of men die as direct complications triggered by a hip fracture. 36% of men who suffer with a hip fracture worldwide. That's a really big figure. That's a really high mortality rate. And once again, same risks. Blood clots related to the hip fracture or severe infections such as a bone infection. Those are the most common dangerous complications. Now, magnesium. Magnesium solidifies bone. If you lack magnesium, you cannot glue the calcium into the bone. The bone crystals expand, they increase, and the bone becomes more friable, kind of stiffened and weakened, and it can break easier. So here's a report. There's a number of them. Magnesium promotes bone health and prevents fractures. It's from the University of Bristol, that's in England, and the University of Eastern Finland. Low magnesium concentrations in the blood, so they're not just going by what people claim they eat or the supplements they claim they take. They're looking at the blood concentration of magnesium. Low concentrations of magnesium in the blood increase the risk of all fractures, like a broken ankle, broken wrist, broken rib, broken spine, and hip fractures in middle-aged men. It's an observational study. It's in the European Journal of Epidemiology. Now, a number of human studies and animal studies have shown that lacking magnesium, it weakens your bone. Magnesium is important for so many things. And if you have sufficient magnesium, it slows down bone turnover biomarkers like the lack of collagen in your urine. That's an important point. When you're losing bone, they don't look at calcium in the urine. They look at breakdown products of collagen. That signals that you're losing bone. So if a doctor's treating you for bone loss, osteopenia, or even worse, osteoporosis, one way they gauge if their treatment is working is they take a urine sample and they look at the amount of collagen being lost in the urine. And if the amount of collagen being lost drops significantly, that means they're doing the right job in building bone. So these are the kind of things you have to look at, and it indicates how important these nutrients are for your bone health. For instance, a 2-year-long study of a group of postmenopausal women, magnesium therapy, greater bone mineral density. Giving these women magnesium prevented fractures. So this particular study, it's on 2,245 men between the age of 42 to 61, and then they followed them for up to 26 years. Over that time, there were 123 fractures. 78 of them were hip fractures, so that's a pretty big number. They found that that the risk of experiencing a fracture was reduced by 44% in the men with higher levels of magnesium in their blood. Once again, they're not depending on food frequency questionnaires, what kind of food, and then they figure out how much magnesium's in the food, and they're not depending on the men's memory for how much magnesium they take as a supplement. They're actually looking in the blood. So higher blood levels of magnesium, significant drop in the risk of losing bone and experiencing a fracture related to weakened bones related to osteopenia and osteoporosis. The men with a lower level of magnesium had an increased risk of fractures, especially hip fractures. Now, the men with very high blood levels of magnesium, none of them experienced a fracture over the 26 years of follow-up. So, I mean, this is a big deal because people with bone loss, I've never seen a doctor tell them take the mineral magnesium. It's not just calcium. It's not just vitamin D. There are other things necessary for building and maintaining bones. When you're young, there's cells that remove old bone, and then there's other cells that replace it with new bone. And there's a good balance when you're younger. But as you grow older, the cells that build bone have slowed down, but the cells that remove bone are still working. So now there's an imbalance and you're losing bone. And that's really, you can help reverse it with these nutrients. I mean, this is not the only way to build bone. Obviously, there are drugs. There's a cost to that. Because some of them have side effects, but still, for some people, it's so important to take those drugs. Now, here's vitamin K. Vitamin K doesn't make the bone look wider and thicker. It fills in the holes in the bone. That's how vitamin K works. So, in other words, you can have healthy-looking bones like they're the right width, because the doctors look at the width of the bone. They don't look inside the bone to see how filled in it is with minerals. So the inside of your bone can look like Swiss cheese, sort of, but the outside is the right width, so the doctor will say, oh, you have healthy bones. They can't help it. That's the only way they really have to check it without doing bone biopsies, which are expensive. Let's forget expensive because they're covered by insurance, but they're painful, and they can have issues. So what vitamin K does, when you're losing bone, you start to develop like this Swiss cheese effect inside the bone. The vitamin K fills that in with minerals. So it's really important. So here's the journal Osteoporosis International. And it's looking at vitamin K supplements at the University of Toronto. And they found that if they add vitamin K to vitamin D3 and calcium, vitamin D3 seems to work better than D2. D2 is called ergocalciferol, D3 is called cholecalciferol, so I always tell people use D3. So adding vitamin K2, there's two forms of vitamin K, vitamin K1 and K2, they both seem to be important. That's why when I make a vitamin K supplement, I include both K1 and K2. Adding vitamin K2 to vitamin D and calcium can reduce the lifetime probability of at least one fracture by 25%. So, what does vitamin K do for the bone? Well, first of all, like I said before, vitamin D and vitamin K and the mineral silica interact with collagen, which is the framework for the bone. It's the superstructure of the bone. It's called the organic matrix, but it's the superstructure of the bone. They interact with collagen so that there's receptor sites that calcium can attach to. But then the vitamin K shoves calcium into the bone. If you lack vitamin K, the calcium doesn't know where to go. So vitamin K is actually the chaperone for calcium. So where vitamin D allows you to absorb calcium and it helps keep it available, it doesn't tell the calcium where to go. It's the vitamin K that tells the calcium where to go. So they're both important. Now, just to go back to magnesium. Just to go back to magnesium, we were talking about magnesium before the vitamin K. This is the Norwegian Institute of Public Health. And they're showing that magnesium, it's really important for preventing a hip fracture because a hip fracture is the most dangerous fracture. And this is for both men and women. So this is the Norwegian Institute of Public Health. They're looking at approximately 700,000 men and women over a 7-year period. In men, there were 5,500 hip fractures over the 7-year period. In women, there was 13,600 hip fractures over the 7-year period. And they found that there's really an inverse association, I'll explain what that is in a minute, between the amount of magnesium in your blood and the risk of hip fracture in both men and women. It's published in the journal Bone, where you would expect to find a study like this. So what does an inverse association mean? Well, when you get magnesium up to a good enough level, it'll really help lower your risk of having a fracture or developing osteopenia or osteoporosis. Now, who is this important for? Well, anybody on a laxative, anybody on drugs to treat ulcers like proton pump inhibitors, because they could disrupt the absorption of magnesium because you absorb magnesium from the upper digestive tract. Diabetics lose magnesium in the urine. People with poor diets. I think it's something like 70% of Americans, according to the NANES surveys, are low in magnesium. 70% or more of Americans are low in magnesium, so that's terrible for your bones. Now, there's a nutrient in certain foods called resveratrol that builds bone. It's very interesting. There are certain things in foods that build bone. For instance, fish oils. Taking a fish oil capsule, taking a krill oil capsule, or eating fish builds bone. There's plenty of evidence for that. There's many studies. Drinking green tea builds bone. It's very interesting the way it does it. We've covered it in a previous episode of green tea and bone health. Melatonin at bedtime builds bone, but so does resveratrol. Resveratrol is a very interesting supplement. They generally use it for brain health. It helps regenerate tissues and restore circulation to an aging brain. And we've done episodes on that also. But this is research from Sun Yat-sen University in China. And they're looking at 2,140 elderly people with an average age of 71. Those with the highest consumption of resveratrol, their risk of hip fracture was reduced by 80% compared to those with the lowest intake of resveratrol. So I feel comfortable in reading you that report because there's a number of studies that show that resveratrol triggers the building of bone. And I take resveratrol every day. I take 200 milligrams every day with my breakfast because I'm an older guy. It's good for circulation to my brain. It's good for protecting my brain and healing certain tissues in my brain. It's good for my memory, in other words. But at the same time, I know it's great for my hip. I know it's great for my bones. It does a lot of really good things. Type into our search engine where our podcast episodes are on our website, invitehealth.com. You could type in resveratrol and all those studies come up. Or if you want to type in bone, all the episodes with bone will come up. So in any event, let me give you a call to action. I mean, what do you do? Well, we know that exercise is important for bone building. There's certain parts in your bone inside the marrow where you create immune cells, and there's certain parts in your bone where you create blood cells, etc. And exercise promotes the activity inside the bone marrow, but it also strengthens the bone. And this is very interesting. If you do an arm exercise, it doesn't strengthen your legs typically. You have to do a leg exercise, right? But it's not like that with bone. Any exercise strengthens your bone. So even if you exercise your arms, your leg bones get a little bit stronger because the hormones the body releases to build bone are non-specific. They affect the entire skeleton. But they've shown that weight-bearing exercise seems to be better for building skeleton. Because if you're walking, let's say, or you're doing some light running, your bones kind of have this brain where the bone cells work together and they integrate their functions, and you'll see that like the pelvic bones and the thigh bone and the leg bones in general and the lower spine will get thicker and stronger by doing leg exercises. So that's just some interesting stuff. So exercise is good for bone. If you do sweaty exercise, you can actually lose bone unless you take like a bone formula before you do exercise, sweaty exercise. So let's explain that. Your blood has to have a certain level of electrolytes, like potassium and sodium and chloride and calcium and magnesium, right? When you sweat, you lose them. And if you don't have enough electrolytes, it's very dangerous. So the body borrows the electrolytes from your bones. However, if you take a bone formula before you do sweaty exercise, there's enough electrolytes floating around the bloodstream temporarily that the body won't borrow those electrolytes from your bone. So it's important to take like a bone formula with things like calcium and magnesium in it before you do sweaty exercises. It's important to do exercise in general for your bone. It builds bone, and it also builds immune cells and red blood cells, etc. Sleep, you build bone when you sleep, and melatonin is an important part of that. So if you're not sleeping at night, this happens especially in older people. They start to their melatonin really starts to dwindle. Take some melatonin. And the study showed that 3 milligrams of melatonin before bedtime is a perfect amount of melatonin. Take a formula that's clean, like we make a bone powder, that's going to have all these different ingredients to build bone. Now, I like powders. Why? Some people, a lot of calcium pills are horse pills. So some people gag on them. And if they have to take 2 a day, they're really going to be resistant. They're not going to want to take that second pill and go through that again. So if you don't take like enough calcium, it's not going to help. Plus, some of the calcium pills are made incorrectly and they don't break down and they wind up in the sewer. They pass right through you and they go into the sewer. So when you take a powder, 1, it's easy to swallow, and 2, because it's a powder, it's already digested, so it's easy to absorb. Because people who've had like weight loss surgery, bariatric surgery, people on proton pump inhibitors for ulcers and H. pylori infections, digestive tract issues, people with Crohn's disease and colitis, people with celiac sprue where they have a problem with gluten, people on laxatives, and a whole bunch of other drugs, they don't absorb the minerals for their bones adequately. So a powder gives you a much better chance of absorbing it. And if it's a good powder, you only have to take it once a day. Plus, when we make a product, we super police it to make sure it's a really clean product. We use very high quality ingredients. So you might want to take a powder that would consist of a good calcium, a good magnesium, a good vitamin D, some vitamin K. If they put some boron and silica in there, that's also incredibly helpful because boron kind of seals everything into the bone. It's a mineral. So that's my call to action. And then an alkaline diet, because if you have an acidic diet, your blood's supposed to be slightly alkaline. Your body has to borrow minerals from your bone to improve the pH of your blood and make it more alkaline. So an alkaline diet is simple. You just have to have enough fresh vegetables and some fresh fruit, and that's an alkaline diet. So thanks for tuning into the Invite Podcast. You could find all of our episodes wherever you listen to podcasts, or you could visit invitehealth.com/podcast. Please subscribe, and if you could leave us a review, I'd love it. You could follow us on Facebook, Instagram, and Twitter at Invite Health. And I hope to see you on another episode of the Invite Health Podcast. And thank you so much for listening.